Hi, I'm Hallie. And in this case, we're going to be talking about a case where we have an elderly patient with advanced dementia who is expressing her wishes to have her feeding tube removed. Her adult daughter does not want the tube removed. She's afraid that her mom won't remember to eat. And the patient states that she does not have an advance directive. Um, the daughter is right to be concerned about her mom's nutritional status. Dementia can affect nutritional status in many ways and results sometimes in unintended weight loss and malnutrition. Patients can forget to eat and drink, they can experience dysphagia, they can lose their independence around shopping for and preparing food, and they can eat less due to the sedative effects of medications used to treat dementia. Um, Older adults have an increased protein requirement, and with dementia patients being at risk of reduced intake, they actually have an increased risk of frailty and sarcopenia. Um, Dehydration can occur because of inadequate intake, and then the lack of certain nutrients, including water and electrolytes, is known to affect cognition, can cause confusion, and can contribute to anxiety and agitation and other mental health issues that dementia patients sometimes experience. Um, so, dementia can cause problems with nutrition, but poor nutritional status can also contribute to the progression of the disease. So, nutrition is an important concern for dementia patients, and it makes sense that the daughter is concerned in this case. We don't know what the decision making capability of the patient is. It would have to be assessed by a neurologist or other physician. But given that she has advanced dementia, it would seem unlikely that she has her full decision making capability for complex medical decisions. So, this is an ethical dilemma. We have the autonomy of a patient who is likely incapable or not fully capable of making decisions for herself at odds with the desires of a family member who very may well be her medical surrogate in this case by default. Um, we also have the evidence based practices. And so it requires that we look at autonomy, but balance that with non malfeasance, beneficence, and surrogate decision making. It's unfortunate that the patient doesn't have an advance directive. They're highly recommended, and it would help make her wishes much more clear in this case. But going through the principles in the Academy of Nutrition and Dietetics Code of Ethics, we could start with non malfeasance. So, looking at 1A, it includes the phrase practice using an evidence based approach within areas of competence. And then there's 1E, which states make evidence based practice decisions, taking into account the unique values and circumstances of the patient, client, and community in combination with the practitioner's expertise and judgment. Um, Aspen has put out a position paper on the ethical aspects of artificially administered nutrition and hydration, in which they state that the evidence supports foregoing enteral nutrition in patients with AD. So the evidence based practice in this case may be in alignment with the patient's expressed wishes. The tricky part here is that the daughter feels differently, and the patient may not be capable of making this decision for herself. Continuing with non malfeasance, 1F requires nutrition and dietetics professionals to recognize and exercise professional judgment within the limits of individual qualifications and collaborate with others, seek counsel, and make referrals as appropriate. 1H states nutrition and dietetics professionals need to practice within the limits of their scope and collaborate with the interprofessional team. Aspen recommends that clinicians collaborate with other healthcare professionals when decisions are being made about ANH in patients with AD. So in this case, it may be appropriate to consult with the attending physician, the neurologist, possibly a speech pathologist, and others on the care team. 1G says act in a caring and respectful manner, mindful of individual differences, cultural and ethnic diversity. So applying the standard to the case, clinicians should treat both the patient and the daughter with the respect they deserve, even though they have differing opinions, and one may be more in alignment with the evidence. Moving on to autonomy, Standard 2B includes the phrase comply with all applicable laws and regulations. Most states have a law which allows the assignment of a surrogate decision maker in the event that the patient is unable to make complex medical decisions for themselves. The surrogate is in turn obligated to follow the wishes of the patient and to act in the best interest of the patient. So in this case, it's possible that the daughter would become the surrogate by default if she is next of kin. And she is still supposed to follow her mother's expressed wishes and make decisions in her best interest. Standard 2E states that nutrition and dietetics professionals must provide accurate and truthful information in all communications. So this standard requires that in this case, clinicians should be very clear on the mom's condition and the risks and benefits of EN at this stage. Aspen recommends that the fact that AD is a terminal illness needs to be clearly communicated to the family and patients, and that evidence-based medicine does not support the use of EN in patients with AD. Standard 2H includes the phrase respect patient-client's autonomy. And this is kind of the crux of this particular ethical dilemma. The patient is expressing their wishes, but they may not be capable of making complex medical decisions for themselves. And so how do we respect the autonomy of a patient who may not have that full decision-making capability? Many of the standards of professional come into play in this case. 3A states that nutrition and dietetics professionals should participate in and contribute to decisions that affect the well-being of patients and clients. The patient is stating that the feeding tube is affecting her well-being negatively. So the dietitian would have to look at the evidence and this particular case to see if the feeding tube would be worth it. 3B states that we need to respect the values, rights, knowledge, and skills of colleagues and other professionals. This ties into the previous point that this should be a collaborative process and include other professionals on the care team. 3C is about being respectful, constructive, civil, and professional in all communications. In this case, that applies especially to the communications with the daughter, I think, because her opinion seems most at odds with the other parties, but also other healthcare professionals who may have disagreements about how to proceed. 3H says to communicate in an appropriate level to promote health literacy. So in this case, explaining the evidence on EN in patients with AD, the risks and the benefits, as well as the job of a surrogate, needs to be done in a way that is understandable to the mom and the daughter. Principle 4 is a little bit less involved in this case. However, people at the end of their life have certain human rights. The right to refuse a feeding tube during a terminal illness like AD is something that should be preserved for all people. So you could make the argument that that comes into play here. If I were in this situation, first I would like to speak with the other people in the care team, especially the physician and or the neurologist. I would want to get a clear sense of the patient's decision-making capability, and I would want to discuss any comorbidities which may affect the risks and benefits of ANH. Or the patient's nutritional status. I would want to speak with the speech pathologist, especially if there was any dysphagia present, but also to see if texture modification may be something that could be helpful in increasing this patient's intake if the feeding tube is removed. I would want to speak with the nursing staff assigned to this patient because if the patient is able to eat independently, it'd probably be possible to put them on a schedule and the nurses could help with those reminders to keep her on that schedule. There's a good chance that the evidence-based practice in this case is also in alignment with the patient's wishes. It seems like the patient would be relieved to have the tube removed, and it's also probably likely that the ultimate decision may be up to the daughter as the default surrogate. So I think the conversation with the daughter is most key, and I would say something like this. I wanted to talk with you about your mom's feeding tube. You know that she has been asking to stop her tube feedings. It's uncomfortable for her, and it may be contributing to some agitation. Can you tell me what concerns you have about removing the feeding tube? And then I would want to listen to her concerns, and she would probably bring up her concerns about her mom forgetting to eat and her total calorie and fluid intake. And I would hope to say something like, I completely understand your concern. Wanting to make sure your mom gets enough to eat and drink is a totally understandable thing, and a feeding tube can seem like the simplest way to do that. What we've learned from research, though, is that with advanced dementia, feeding tubes don't actually improve outcomes or help people live longer. And in fact, sometimes they can cause problems, like pneumonia or other complications. They can also make patients more uncomfortable or agitated, which we've noticed with your mom. Because dementia is a progressive condition, your mom won't recover from this. And our goal is to really help to make her as comfortable and happy as possible for the time that she has. As healthcare providers, we always weigh treatments by whether they help more than they hurt. In this case, we don't feel that the feeding tube is giving her benefit, and it's probably lowering her quality of life. If we remove the tube, we won't just stop supporting her. We can still work on ideas to help keep her intake up, and this might include hand feeding, offering foods and drinks that she really likes, scheduling her meal times, and we could consider giving her a high-calorie supplement. I would hope that I could talk the daughter into seeing that removing the feeding tube would be an evidence-based and ethical choice. And I think if not, we would have to continue conversations and hopefully pull in others from the care team and see if we could keep working on it. So this is how I would approach this ethical dilemma, and thank you so much for taking the time to watch my video.